All right, so thank you for the global tallies of the past 24 hours. Now, here in Korea, new studies suggest the daily tally may surpass the 300,000 mark within a fortnight. For more, Choi Min-jung is here in the studio. Min-jung, good to see you again.
Thank you for having me, Sunny.
Right, so the daily tally is looking to surge well past our earlier predictions, Min-jung.
Right, cases have been spiking and our daily tallies appear to be threatening the 200,000 mark. Authorities had initially predicted that the country will see up to 270,000 cases a day by early March. But following more research, medical experts are now suggesting we could see more than 300,000 daily cases in 2 weeks' time. But what's also concerning is the increasing number of severely ill patients as well as deaths. Earlier this month, there were around 200 patients in critical condition and around 20 to 30 daily fatalities. However, now there are more than 500 critically ill patients, with the number of deaths approaching the 3 digits. As such, the occupancy rate of ICU beds has been increasing by a percentage point each day since the start of February, with the figure now at 37%. Authorities predict there could be more than 2,500 patients in critical condition by next month.
And perhaps as part of efforts to better accommodate patients, I understand some medical centers, Min-jung, are treating COVID-19 at regular wards.
That's right, Sunny. The Seoul National University Hospital started treating COVID-19 patients in regular wards starting this week. But for now, only those in intensive post-surgery care and patients who were hospitalized before contracting COVID-19 are allowed to be treated this way. Until recently, all severe COVID-19 patients were assigned to negative pressure rooms, with mild and asymptomatic patients being sent to either recovery from home or a residential treatment center. But now COVID-19 patients who require hospital care for other conditions can also be treated in regular wards regardless of their symptoms. The hospital said, however, that patients who were infected with the virus prior to admission will be restricted. And patients are advised to get their booster shots before admitting themselves to a hospital unless it's an emergency medical situation.
Meanwhile, Min-jung, I hear one district court has hit the brakes on vaccine requirements at restaurants and cafes for those aged below 60. Tell us about that.
That's right, Sunny. The city of Daegu in Gyeongsangbuk-do province is no longer requiring people under 60 to show vaccine passes to enter restaurants and cafes. The Daegu District Court suspended the city's vaccine pass mandate after some 300 people had filed a petition, judging it to be a violation of the basic rights of unvaccinated people. It's the first time that vaccine pass mandates have been blocked at restaurants and cafes for adults in the country. The court also ruled to overturn vaccine pass mandates for teenagers aged 12 to 18, saying that children in this age group are less likely to become severely ill from COVID-19. However, the Daegu municipal government isn't going down without a fight, saying it will file an immediate appeal against the court's ruling.
Right, and hopefully you'll keep us updated on that. Also on the vaccination front, Min-jung, so when can children here start to receive their Fisa vaccines against COVID-19?
Right, authorities said they will announce more details in March after consulting with experts. So we're expecting vaccinations to begin in late March or early April. Given that the vaccination rate among 12-year-olds, the youngest children eligible, has not even reached 10%, authorities are concerned that the figure will also be low for 5 to 11-year-olds. So they say it will be important to come up with a vaccination strategy that is tailored for younger kids. And just to recap, the Ministry of Food and Drug Safety on Wednesday approved the use of smaller doses of the Pfizer vaccine for children aged 5 to 11. The shot has been shown to be 90% effective against COVID-19, with no severe reactions reported in clinical trials.
Min-jung, one final question before you leave us. I hear the schools here in the country have been granted the right to choose their own method of instruction in the new academic year. Tell us about that.
Right, schools will decide for themselves whether to hold in-person or virtual classes. Originally, education authorities advised schools to bring students back to classrooms, but with infections soaring, the Education Ministry is allowing schools to have remote learning as an option for the first 2 weeks. Many schools, though, have yet to decide, and parents, especially those who work, are finding themselves in limbo. Some are also opposed to regular COVID-19 testings at schools over concerns that it could scare their children. So in response, the Seoul Metropolitan Office of Education said it plans to introduce rapid PCR tests using saliva instead, although health authorities have yet to formally approve this method.
Which means we'll have to wait and see. All right, Min-jung, thank you for your report. And I'm seeing you back on Monday and not on Friday.
Right, that's right.